Hi, well, for me it's evening here in New Delhi, but good morning, good afternoon, good evening, depending on where you are, and it gives me great pleasure to open this discussion. I think the reason for the discussion is very clear that whilst CLTS is a relatively new approach in the sanitation world, we don't always understand the best way to measure the communal outcomes. Some people are still counting toilets, others are measuring ODF. What constitutes ODF is different, of course, in every country. What constitutes success? And we're seeing very different rates of success, and that's one of the main reasons for this discussion. We've brought all these experts together today just to kick this idea around a little bit, really, and we're going to hear from them all and their opinions on this. Before I get started, could I just ask each of the participants to introduce themselves very briefly?
Okay, my name is Ada Oko-Williams, and I work with WaterAid right now, the London office, providing support, technical support with regards to sanitation to our country programs across Africa and Asia. But before I moved to the UK office, I had worked in West Africa, basically supporting WaterAid programs across the region. Thank you.
Thanks, Ada. And I should have said that myself, I also worked in West Africa, and we worked very closely together for many years, but I'm now moved to Delhi. Darren, please.
Yeah, good morning, good evening. My name's Darren Saywell. I'm the Senior Director for Water Sanitation and Health at Plan USA. Been supporting Plan's work for the last 4 years or so now. And in particular looking at issues around cost effectiveness and effectiveness more generally of CLTS with our partners at the UNC Water Institute.
Thank you. And Hans?
Yes, I'm Hans Mosler from Eawag, the Swiss Federal Institute of Aquatic Science and Technology. I'm a professor in social psychology at the University of Zurich and head of the Environmental and Health Psychology cluster at Eawag. Currently, we are conducting a research project financed by the Gates Foundation, and the project is called Determining the Effectiveness and the Mode of Operation of CLTS, with a strong focus on the mode of operation, because we want to understand how CLTS works, not whether it works or not. But I have to say we are in our first phase, and so far we have no results to show. Thank you.
Okay, thank you. And Jonny?
Hi, good morning, everyone. My name is Jonny Crocker, and I'm working on my PhD at the Water Institute at the University of North Carolina. And if I can figure out directions correctly, I work with Darren up in that corner. I've been working with him for about the last 4 years, working to evaluate some of the ways that Plan International has been implementing CLTS in Africa. And I think Pippa called us experts when she introduced us originally. And looking around these little pictures here, I can tell that I'm the youngest person on this call, so expert might be a little bit of too friendly of a term for me, but I'll do my best. I certainly have some opinions to share.
I'm sure you have. That's great, and we're looking forward to the debate. Let's hope it's lively. So maybe I could just kick off with the first question. Perhaps just to set the scene, we should just exactly determine how we regularly measure community outcomes in sanitation. Hans, perhaps from your study, you've got a clear handle on this?
Yes. Okay, what is normally measured and reported, but not measured in a standardized way, I have to say, is the latrine coverage as an outcome of sanitation programs. However, as we know, coverage is not the same as using a latrine in a consistent way, which is even the more important outcome. Many people have latrines but don't use them. And therefore we try to measure how consistently latrines are used. And what is also reported but also not measured in a standardized way is the number of villages declared as ODF. We use village spot checks observations, looking at the use or non-use of open defecation sites, for example. Finish. Yeah. Thank you.
Okay. Would anybody like to add to that? Ada, perhaps?
Yes, I would like to add to that. I agree with Hans that measuring, we're counting basically toilets right now as outcomes, people having latrines as outcomes of sanitation interventions. But there are some emerging, or rather say some interesting development with how, people measure, or how the sector is beginning to measure outcomes of sanitation intervention, and particularly using the approach community-led to sanitation. We're seeing one of the key elements for measurement is the open defecation-free protocols that countries have. And as I mentioned before, my experience from West Africa, some countries are already stretching that to go beyond just measuring the infrastructure that is on ground and talking about the issues of behavior change and use of facilities. So in some countries, interestingly, they're beginning to measure of course, using process right now, use and changing behavior through their open defecation-free certification protocols. So that's an interesting space to watch in terms of how we're developing in that regard, yes. But to a very large extent and a majority, we're still counting facilities provided as access, not necessarily measuring behavior change, yeah.
Yeah, counting facilities and numbers of converts, as it were.
Yeah.
Anything else to add on the basic measurement, Darren or Jonny, before we move on to the second question?
I could mention a couple thoughts. I think Hans and Ada have described pretty much all of the main components. I think it's the only thing that's important to measure is that, or to mention is there's some of those indicators they've mentioned are done through surveys and some through observation. And I guess each of those different measures, they have different benefits and challenges in terms of their ease of measure and their actual accuracy. And I think CLTS has introduced some interesting challenges and opportunities in that we're used to seeing, as Hans says, latrine access reported internationally, but ODF verifications are now starting to be another statistic that's available across countries.
Yeah.
I mean, just to build on that, I think one of the things that we struggle with at Plan and more generally in the sector is that ODF, whilst it's a simple and seemingly intuitive indicator, actually isn't very useful for us, and we need to be able to unpack greater process indicators that chart, the advancement towards an open defecation free environment in the communities that we work in. So I think that's one of the things that we notice. I mean, also within Plan, the approach for ODF verification and certification tends to be very case dependent on the country. So how do we get some consistency across, across what's happening and what criteria are being used for that certification process?
Okay. So therein perhaps lies the first problem and challenge that we have with the CLTS process is that we may be comparing apples and pears between countries, but certainly one would hope within one country that we would still be comparing the same thing, and so it's very useful at that level. Perhaps we can move on to the main question of the topic, which is about the success rates. So yes, if we're measuring coverage, we can see the numbers go up, and yes, if we're measuring open defecation-free communities, we can see the numbers go up. But what do we think actually is an appropriate success rate? Are we talking over 50%, which I would, on any other standard expect to be a good success rate? In some countries, the success rate appears to be much lower. Hans, what's your take on the success rate idea?
No idea about the success rate, but an idea about and what is the right metric to measure. But this is the second question of this second part. So maybe that another one steps in here.
Oh, Jonny, do you have some success rate ideas then?
Yeah, I think I was just going to mention a couple of figures to prime Hans's points. It's difficult to get comprehensive ODF data from countries around the world. Andy Robinson, I think it was with UNICEF, someone could correct me if I'm wrong, looked at a variety of countries in Southeast Asia and found that reported ODF rates, these are the official rates reported by government and their partners, varied from 10 to 50% ODF. The numbers are much harder to track down for African countries, maybe because CLTS is relatively newer to the continent. But from what I found looking around, the reported success rates vary from 50% ODF all the way up to 90+%. So we see a lot of variation in what's reported as ODF rates from one region to another.
Okay, thank you. So Hans, now you would like to reply to those challenges?
Yeah, I like to, yeah. We have to define what to measure and how to measure it, yes? What to measure, okay, we can measure by observations and by self-report. And what is to be measured are toilets built, toilets used all times, and we have to measure also open defecation. And the result is the percentage of people performing what kind of behavior. And what is the mixture of behavior? Because there will always be some, maybe not, but for many people, many households, there is a mixture of behavior between open defecation and using the toilets. Yeah? Then second, how to measure. I think this is quite clear for me. It should be a representative sample of households of a community. We could use, for example, a random route method for having a representative sample. And the result will be the diffusion or the spread of the new behavior, meaning that we have then the percentage of people which have adopted the behavior, the ODF behavior. Yes. We also survey social cohesion and social capital, trust, solidarity, collective action, because we want to find out what kind of community factors influence behavior change and which impact CLTS can have on these socio-communal determinants. It is crucial to understand, it is crucial to know whether people understand coming to an ODF community as a collective action. Do they understand that they have to change together? Or is it for everybody alone in his household? Thank you.
Okay, thank you, Hans. Ada, would you have anything to add to that point?
Not exactly, not a lot to add anymore. Hans really described it. But the one point that I just like to say is in terms of measurement, the universality of measurement really, given that there are so many variations in context and what leads to what result, can we really aim to have, a sort of measurement that is universal and can be applied all across the board to really get a true picture of what's happening on the ground or not? So that's just a question, like it is on my mind. He's mentioned things like social capital. It's not the same, for example, in Africa and in Asia. What you have as background, it's not exactly the same thing. So how do we then measure something that's not the same across the board? But it's possible, it's doable, but I'm just wondering how that works. It'll be interesting to hear, maybe in the discussion, for the ideas that people have, yeah.
I agree, yes. I mean, a very useful measure internally, but possibly not comparable across countries. So one of the challenges I think we all have is, my lights have just gone out. One of the challenges that we all have across the country is that, across different countries, is this measurement. Sorry, I can no longer read my crib sheet. Of the metrics, and as we discussed, rates seem to be very much higher in Africa than Asia, and I wondered if you had any particular understanding of why that might be, Ada?
Yeah, it's kind of related to the point I started to make before. One big thing is also, like I said, it's just the necessary input, really. I mean, the input at different levels varies, and so we cannot assume or expect the same level of outcomes across the board. For me, issues like the social capital, as you said, how communities mobilize, how communities self-organize is critical, especially for an approach like CLTS, in terms of what outcomes you get. Also, governance, it's another level. And then the level of input, and most of these programs, to be honest, have been driven by development partners. So what level of input are the programs receiving from country to country? Are there countries where the external development partners have really pushed in enough resources, time, energy, and therefore the results are different? I'm just asking. Or are there countries where they haven't received that level of support and input, and therefore the kind of results we see? So these are the issues that I think we really need to unpack in terms of determining or understanding the results we're getting from different places, and therefore these variances, huge variances in terms of CLTS results.
I think one thing, thank you, Ada. I think one thing that I would also highlight is just the relative size of communities. I mean, even within Africa, we have very, very small communities in Mali, like under 50 people, versus your average community in Nigeria, which is over 1,000 people. And of course, in India, where I am now, very, very large communities, much, much bigger. So it's not really fair to say we've got so many communities, ODF, and call that a comparison. Darren, do you have anything to add on that discussion?
Yeah, I think just building on that, I think you know, what we're tending to find through the work that we've been doing with in 3 countries with the Water Institute, but more generally, I think, is that maybe success rates is the wrong thing to focus on, or the number behind the success rate is the wrong thing to focus on. And what might be better to focus on is what are the boundary conditions or the performance envelope for different approaches to improving sanitation, whether it's through CLTS or sanitation marketing or behavior change communications. We need to think about the optimal environment in which that approach will have the greatest impact. And what I worry about with CLTS, as I do with all approaches, is if we're quoting success rates of an average between 33 and 40%, is, you know, are we really thinking rigorously about which approach is best suited to what environment? And wouldn't those success rates be higher if we were unpacking our toolbox, so to speak, and using different tools in different environments? So, I mean, one of the things I want to sort of generate a debate around is, you know, do we know what that performance envelope is, and are we being effective in the use of different approaches for those different environments?
I think that's a really good point, Darren. Hans, you wanted to add something?
Yes, I think we have to differentiate between the 2 questions. One is, what are the causes of these different success rates? And the other one is, how do we measure success rates? And I think we could develop a standardized tool to measure success rates, you know, let's say all over the world in the same manner. Thank you.
Yeah, okay. I think this leads, oh, sorry, Ada, yes, please.
Yes, I mean, very interesting point that Darren and Hans just made in terms of what's causing it. I think I was speaking more from the perspective and background of what is leading to the success rates, yeah? And that's why I talk about all of the different things that go into the pot. But one thing I'd just like to say to, again, building on Hans' point, Darren's point, that there are some constants that are non-negotiable in terms of what leads to what can create this success rate. And one of it is actually looking at the sector, a strengthened sector, and I'm looking more at what institutions, what platforms exist in the sector that are common across the board. And in that sense, I'm thinking government, what capacities exist at that level. That can be something that is constant, and we can build on that. Then you add on every government, every people really, every country really does have some sort of government and some sort of responsibility. If we focus on that, strengthening the capacity that exists within the sector, at least we have one platform, a common ground to begin to add on the different variables and therefore the results we get in terms of the causals. Yeah.
Okay, that's a really good point. Thank you. And I think, as I was just about to say earlier, that I think the point that Darren made leads very nicely into the third question that I was going to ask, which is how do we compare in the sanitation sector with other sectors? And Darren, I know you know the health sector particularly well as well, and I know that Jonny, you've been doing some research on this too. So how do we compare in sanitation with other approaches in other sectors and what they would constitute success rates? Darren?
Not sure I've got a great deal to add there. I mean, I think that, I think this is where we're bumping up against the sort of boundary of our understanding of metrics. I don't have at my fingertips comparable success rates for other types of interventions outside of WASH. What I was going to say is that, if we were to take one country the plan works in, and look at comparing different, different approaches, you very quickly run into a whole bunch of methodological issues around how you're measuring success rates. We know, for instance, in Cambodia, which is a country that we're working in, that on the CLTS side, there's a success rate of ODF achievement of between something like 33 and 40% of the communities that we're working in. If we were to compare that to sanitation marketing in Cambodia, WSP have done a whole bunch of work on that, as you know. I mean, some of the quoted figures there are around sort of 7 or 8% improvement of sanitation in program areas. But I'm not sure that, comparing, how big is mine compared to yours in terms of numbers really helps us. Again, I think it's more about the environment in which those approaches are bedding down. So, I think it's really difficult to compare, and I think that's seems to me that's an area for sort of methodological development. So that's what I wanted to say.
All right, thank you. Jonny?
Yeah, thank you. I'll just, in order to answer this question, I want to reflect very quickly on some of the thoughts we've had on variation in ODF measures. I think one of the things that we're trying to compare is a metric that is not necessarily comparable. For example, ODF is a community-level metric, so a community either is or is not ODF. It only has 2 values across an entire community. So just to take an example, if you were in Cambodia, for example, say there was one community where 95% of the households are defecating in the open all of the time. That community will not pass ODF certification. And if you go to another community where a single household among 1,000, for example, is defecating in the open all the time, that one will also not pass certification. And so you have 2 communities, one where there's widespread open defecation and the environment is probably terribly dirty, and the other one where the community is probably near pristine and practically ODF. Both of them will be measured and reported as failures. So I think, not to downplay the value of ODF as a goal, as a target. I think one of the reasons CLTS has been successful is because it does motivate communities to move the entirety of their households to ODF practice. But I think when we come to comparing approaches, we should really be thinking about household level measures, or like Hans was discussing earlier, maybe the percent of the community practicing open defecation instead of whether anybody is practicing open defecation. If I can take...
Well, I get where you're coming from, Jonny, but... Yes, please carry on.
Yeah, I mean, again, not to downplay the value of ODF, I think that should remain a target and should be something that is part of the CLTS process for motivating. But, 2 communities are not the same if they're not certified as ODF. When it comes to comparing approaches, I'll just build on Darren's example figures from Cambodia, where he's compared a little bit to sanitation marketing. I think from my experience, I've worked with other sanitation approaches before, and the success figures there are often on the order of 30 or 40 percentage point increases in usage of latrines during a program. So CLTS, we have very few rigorous studies on CLTS impacts, but the UNICEF study in Mali found 70 percentage point reductions in open defecation. That might not necessarily bring every community to ODF, but that is an amazing and dramatic positive impact, I think, that shouldn't be downplayed. That's a dramatic impact that puts it well and above many other sanitation approaches. And in our project with Plan, we're seeing up to 50% reductions in open defecation during the program. And I think part of the reason that we see such dramatic benefits is because CLTS does motivate communities to act together, where with sanitation marketing, you may go door to door to do sales, and if you find a household that can't afford a latrine, they won't buy it. Or if you find a household that's not convinced they want a latrine, then they won't buy one. Whereas in CLTS, motivating the community together, they could influence that person who doesn't want a latrine, or they can offer support to poor households. So you may find CLTS converts households that otherwise wouldn't be converted in other approaches.
Yeah, thank you. And I can definitely vouch for the program in Mali, which I agree had a hugely high success rate. And I think part of that was due to the fact that those communities were very small. And as you say, it was down to peer pressure, perhaps. So you're right, but highly controversial what you suggest about measuring household. Yeah, I can see, Hans, you want to say something. Please add.
About motivating. I said I have no results so far, but I have some preliminary results from Cambodia, and they indicate that none of the formally declared ODF communities is now ODF. However, the households' ODF frequency is higher in communities formally declared ODF. So it's really motivating. Thank you.
Okay. Yeah, I mean, we've had a similar survey in India that shows that less than 10% of those declared ODF are still ODF. So sustainability is definitely an issue that's high on the agenda in terms of how we not only how we measure, but how we go back and continue to monitor. I think we do need to move on in the interest of time. I think I should just move on to the last question that we had planned, perhaps, which is about optimizing behavioral intervention success rates. So do any of you have any particular handy hints, as it were, for how we can best optimize these behavioral interventions to make sure that we get the highest success rates possible? Darren, from your studies?
Yeah, I mean, very quickly, I think one of the things that Plan has, like other NGOs that are doing behavior change, one of the things I think we've learned a lot about is, the initial process of triggering change. I think that where we're all struggling is the longer tail of moving towards social norms, and how do you transit between initial behavior change to social norms seems like a very rich area for us to be focusing on. I think there are 5 things that Plan tries to do, which is looking at bridging that gap. And very briefly, there are things like making sure there's a supportive environment that's behind behavior change, so that there is infrastructure and products are immediately available once behavior has been triggered. I think secondly, it's around leveraging context or milestone moments, looking at context changes during which time people might be more open to creating new behaviors or piggybacking on new or existing behaviors. Thirdly, it's about eliminating friction. What are the pull factors that eliminate the choice, the steps, or the perceived effort for engaging in new behaviors? And then last 2 points, sort of, look at interventions which can be learned as you're doing them, and make sure that the intervention has tactics that people can actually do to reinforce the behavior. And then lastly, sort of conscious storytelling. So once the habit is formed, encourage people to infuse that action with personal significance. For instance, images that remind caregivers if they feed their children with dirty hands, then they may be making their child sick. So it's those five types of issues or trigger points which I think are helping us move towards longer term social norms.
Yeah, okay, thank you very much. That's really useful. Would anybody like to add to that in terms of good optimization ideas? Hans, please.
Yes, I would like to add that in our opinion, success rates could be optimized by using a systematic behavior change approach, meaning that we should use theory of health psychology and trying to first understand the different behavioral determinants, behavioral drivers of OD and ODF people. And additionally, we also have to understand the mindsets of different ODF adopter groups, because there are people who join it at the very beginning and people who join it at the end. So for the theory of diffusion of innovation, there are 5 adopter groups: innovators, early adopters, early majority, late majority, and laggards. And these groups have different drivers of behavior change. The early majority might be susceptible to opinion leader influence. I forgot the innovators and the early adopters before. They might be motivated by health concerns. And the late majority and laggards are influenced by social norms. They see others do it, so they have to join. Yeah? And we have conducted a study on adopter groups of solar water disinfection in Bolivia, which deals exactly with these adopter groups which need different interventions to change their behavior. So my plea is we have to understand mindsets of people who do OD and people who do ODF. Thanks.
Okay, I think that's really important. So in a nutshell, we need to just look a bit more at the behavioral standards and how we're measuring those to really understand them a bit better. Okay, I'm afraid I'm going to have to end the discussion here because we need to move now into the group discussions where everybody will get a chance to join in with the debate. So bearing in mind some of the questions that have been raised in this half-hour panel discussion, I want to thank you all for listening. And I'll hand over to Pippa now to move into the group discussions. Thank you.